Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and my special guest today is Andy Zapata. He is the CEO of Physical Therapy Now. Welcome to the show, Andy.
Thank you, Neil. Thank you for having us.
Well, let's get right to it. Physical therapy is extremely important. There's a lot of people that need your services. So tell me a little bit about your business, Physical Therapy Now, what you do and who you help.
So what we do is we are essentially what we say, the name, Physical Therapy Now. We are the solution to many different things. When somebody has either acute pain, chronic pain, whether it be because of a surgery, because of an injury, because of an accident, because their muscles are getting weaker and you need to get stronger, or you've had an injury, we are the solution for that. What we like to say is that we are the injury prevention specialist and we are the physical therapy provider that can help you stay off medication and create happiness is what our mission is.
And you've been in this business quite a while. I think you opened your first one in 2003. Is that correct?
So I started right off with my first practice. I opened it right out of college. And I was able to adapt very quickly to the industry in healthcare, which is there's a lot of red tape between the insurance companies. But I was able to adapt and help many people in my life, thousands of people.
Well, that's great. I love doing interviews with people that are really getting out there and helping people. And obviously making money is very important in business as well. But when you can really make a difference in people's lives like physical therapists do, it really is great to, hear these kinds of stories. So explain to me really what a physical therapist is, because it does take quite a while to become a physical therapist, doesn't it?
So it's now in the state of Florida, I think nationally actually, you have to be a doctor in physical therapy. And what that means is that you have to go to college for at least 8 years, university, 8 years, so that you can get this degree. It used to be a bachelor's degree, and about 10 years ago, it became a doctorate degree now. So yes, there's a lot of schooling behind it. There's a lot of anatomy and physiology behind it. And now the therapists that are graduating now, they are very, very knowledgeable in injuries and injury prevention, and the anatomy of the patient and what causes those injuries is really what they're getting down to it.
So it's like a step above some of the other things that people might think of when they're dealing with pain. Obviously, chiropractors are doctors as well, but then you've got, massage therapists that don't quite have the same education as physical therapists, do they?
That's right. So everybody has what I like to say, their special gifts. So massage therapy is a very reputable career, and so is chiropractic. But when you become a physical therapist, it's just a step of that and a step below a physiatrist, right? Because a physiatrist is already an MD. He's a doctor in physical medicine. So it's right in between physiatrist and right above chiropractor and massage therapy. That's correct.
So explain to me the biggest problem that people have when they come to you. What kind of patients do you see? What kind of problems do they have?
So I'll give you the simple. We have patients that come in with a simple ankle sprain. They could have been running. They could have been climbing a stair. They could have been performing an activity, dancing, and they twist an ankle. So that's the basic reason why somebody would come to me. Their ankle is swollen. Sometimes it's more swollen than others, and so that has different grades. And then sometimes we have patients that have suffered strokes and heart attacks. We have patients that have had motorcycle accidents, car accidents, workers' comp accidents, and then they have tendon rupture repairs that the orthopedic surgeon has repaired, or they have a spine surgery, neck or back surgery, and they come to physical therapy after that to be able to maintain their same range of motion, their same muscle strength they had before the accident. So our goal is always to try to restore the patient to its prior level of function before they had that accident or that incident. Does that make sense?
Yes, definitely. I was a soccer player myself and was very good friends with the physical therapist and the trainers. I seem to be there all the time. So I'm very, very familiar with those kinds of injuries. And explain to me the difference between acute pain and chronic pain.
Absolutely. So an acute pain it means sudden. When somebody twists an ankle, when somebody has an accident, a slip and fall, or somebody just they're working in their garden and all of a sudden they pick up a plant and their back starts hurting, and then something that's never happened before. So this is what we consider acute pain. There's different types of treatment for acute pain because it can be just a muscle spasm. It can be a muscle strain. It can be something that can be fixed with just a few physical therapy sessions. Now, when you talk about chronic pain is when that pain has not, when that acute pain has not subsided. So now you have, you've been suffering from this pain for a few months, 6, 7, 8 months, and you've tried different things, and now that pain has not gone away. Now it's a different type of treatment, a little bit more intense, to try to identify first of all what's going on and why you haven't been able to get better, but also what are we going to do about it and how can we modify different things in your life that can potentially help you alleviate or eliminate that pain.
I imagine every patient is different that comes in to see you. They're dealing with different problems. So if you have somebody that comes in with an ankle sprain, for example, and they were like myself, a soccer player, they're fit and healthy. What happens during that time of rehabilitation to their muscles that needs to get fixed again?
So this is what I love about physical therapy. Physical therapy is something that is individualized. So we don't treat everybody the same just because you have an ankle sprain. So let's say you're a soccer player, you have an ankle sprain, and I get Mrs. Smith, who's 95 years old, takes care of her dog and has an ankle sprain. So there's different ways that we treat you, and our goal is always to get you back to your prior level of function and your prior activities. So if your goal is you want to go back to playing soccer, we will create an individualized plan of care to be able to get you back to playing that soccer game that you were playing before. Or if you're a housewife and you have house chores, then we will create an individual plan of care so that you can go back to doing the activities that you love at home.
Now, physical therapists should be top of mind when something like this happens, whether it is, an injury, you'd think a physical therapist, but maybe chronic pain doesn't quite get the same notice from a physical therapist. People go to their MDs or maybe a chiropractor to try and solve these. Why don't people think to go to a physical therapist first?
So physical therapy is still a fairly new career. It's only, I think, a little less than a century. So people don't think of physical therapists kind of like first line of defense. However, the American Physical Therapy Association has been trying to get the word out more that physical therapists should be the first person you go to for a musculoskeletal injury or pain. So that's why they created a doctor in physical therapy instead of the bachelor's in physical therapy. And so since now we're doctors in physical therapy, what happens is that people are starting to notice that you can come directly to a physical therapist without having to go to the doctor first. So now we're seeing a change of the way that patients find us and they come into our center. And that's why we decided to rebrand with the word physical therapy now, because you can actually come in today to see a physical therapist without having to go to your doctor first.
Right. And I was going to ask about that. I'm glad you mentioned it because that is really a misconception that people have, that you have to go to a doctor, you have to get a prescription before you can go and see a physical therapist. Is that right?
That's right. So again, for the last century, that's the way that the relationship between doctors and physical therapists have been. That you would have to have gone to a doctor, get a referral, but now things have changed, mainly because the legislation has changed and our education has changed. So because those two things happened, then now you're able to come see a physical therapist now.
So talk to me about the logistics of paying for this right now. Is this an insurance business or is this a cash business?
So this is both. This is an insurance business because for the insurance, physical therapist is a great solution to somebody that might have gotten surgery before. And not I don't. Some surgeons, they prefer to do physical therapist conservative care before they do surgery, and the insurance is like that because at the end of the day, it costs a little bit less to do physical therapy than just to go straight into surgery, and the patients are getting the same results, right? So somebody that might have had a small meniscus tear before that would have rushed to surgery, now they're saying, hey, let's go conserve. Let's try something conservative. Let's do some physical therapy. Let's see if you get better. And if you don't get better, then we'll try to do we'll try the surgery. So we've noticed that a lot of pain management physicians, a lot of orthopedic surgeons, a lot of physiatrists, they're referring to physical therapy more than before because this is what the insurance wants and they're getting great results. So it's a win-win for the doctor, it's a win-win for the patient, and it's a win-win for the insurance company.
Definitely, sending people to surgery right away obviously is really expensive and it's not always the best solution. So, just repairing those muscles and giving the tendons time to heal, I imagine, is a lot more beneficial.
Absolutely. Absolutely.
So share with me some of the fears people might have about going to see a physical therapist.
So believe it or not, the main fear is, does this hurt? And the answer is it might hurt. Sometimes it hurts more than others. If you've had a tendon repair, if you've had a knee ACL reconstruction, it is going to hurt, but the pain is not a intolerable pain. So we are, as physical therapists, are trained to identify and know how much pain is your body supposed to feel. And everybody's body is a little bit different. But I, for example, know how much pain you're supposed to feel whenever I do this specific manipulation or exercise, and I know that I'm not supposed to go past a certain range of pain that you can tolerate. So it's almost like a good pain, but sometimes, not always, there is a little bit of associated pain. So that's the main fear. The second fear is that this is going to take a very long time. This is going to take months and months and months. And typically on average, our visits last about a month, and that's about 12 visits a month. And what the doctors and the protocol for the physical therapist sessions have in between the doctors and the physical therapists, they've identified that 3 times a week is the right amount of physical therapy. So some patients ask me, hey Andy, am I going to have to go every single day? No. Typically it's 3 times a week times 4 weeks, which is 12 sessions per month. And that's usually what a typical physical therapy session should last. And that can cure most reconstructive surgeries, most acute pain, and most chronic pain as well.
Now, what do you see as some of the traits that the patients that come to you? Some of them are going to be really successful going through your program. Some maybe not as successful. What are the common traits of those successful patients?
You always see patients that come and they're energized, and even if they're in pain, they still come to the therapy sessions. And those are the people that do the best. The people that complete the doctor's orders and the physical therapist plan of care. We always see that those patients have a better outcome than the patients that do not complete their plan of care. And sometimes they don't complete their plan of care again because they're in fear that it might not work. It's not working as fast. And sometimes it's too expensive for the patient. But there's definitely fear in physical therapy. But I would say the main fear and the main thing is the pain. But we have seen great results for those patients that finish their protocol.
Mm-hmm. And it does take work, obviously.
Absolutely.
Um,
This is not something that the therapist himself is going to be able to help you. It is a combination between what you do at home, what the therapist teaches you as a home exercise program, and what the therapist does in the practice. So we're only here three hours out of the week. The rest is up to you and what we teach you for you to take home and implement at home or at your job. But yeah, it's very minimal what we have to give you, but it's very beneficial.
and we live in a fast-paced society where we want the quick fix all the time.
That's right.
Now, do you prescribe medicine, or um, do you have a program that needs medicine as well as the physical therapy? Are you purely physical therapy and you don't want medicine there at all?
So we are a multidisciplinary approach. We love all types of physicians and all type of professionals, and we believe that each professional brings the right amount of care at the right time. So we do employ massage therapists, we do employ chiropractors, we have, of course, physical therapists. But if all three of these multidisciplinary practitioners that we have encompassed in our practice, if you fail all three of these, then we do have an orthopedic surgeon and we do have a pain management physiatrist that would come in and do an evaluation and see if maybe you do need a small injection, even though that would be like our last resort, right? Or
Mm.
second to last resort. Our last resort would say if you fail our our initial steps, which is massage therapy, chiropractic, and physical therapy. If you fail that, then we take you to the pain management or orthopedic surgeon for evaluation. And if you fail their medication plan of care, then we set you up for a surgical consultation, and that would be the last step.
Well, you've definitely got to be able to do those exercises that are going to help recover, and it's hard to do them if there is too much pain there. So that is understandable.
But Neil, less than 1% of our patients go to that last step.
Mm-hmm.
So that's incredible. The amount of people we've been able to help avoid surgery or even avoid medication or injection is incredible. I think only 2 to 3% go to the second phase, and less than 1% go to the third phase, which is that surgery phase.
Well, that is amazing. Just having, really 2-3% of people having to go to, the surgery or even get pain medicine, that shows just how effective physical therapy can be in, relief from pain as well as recovery from injuries.
Absolutely.
So tell me, Andy, about, you've been in this business for a long time. Is there any one story that stands out to you that, somebody came to you with a major problem in their life that's really hampering their lifestyle? How were you able to help them, and what kind of outcome did it achieve for them? How did it change their life?
Neil, one story that really sticks out in my mind is I had this 19-year-old kid who was flown in from South America. This was in 2008, and the young kid, he was 19 years old. He was working out at the gym, and he had a stroke. A few hours later, he had another one, and a few days later, he had another one. A total of 3 strokes. This gentleman was doing very bad. So bad that they were able to fly him into Jackson Memorial Hospital down here in Miami, who did an amazing job at saving his life. I mean, the technology that Jackson Memorial has is amazing. But Jackson Memorial, what they did is they saved his life, but they were not able to do the secondary phase, which is after somebody suffers a stroke or a heart attack. What happens after that, right? And so this gentleman had no insurance. This gentleman was, again, he came from South America. So somebody, I think it was my accountant that knew somebody that knew somebody that knew him, that referred him to us. And when I saw this kid, he showed up on my door. I did my evaluation to this young kid. I look at the mom and I said, ma'am, Your son is too involved. Like and this is me the early age in my career, right? I said, your son is too involved. I don't think we can help him here. He's very involved. Like this is something for somebody else, not for us. And the mother started crying. She couldn't stop crying, and I tried to calm her down. And I did the evaluation, but I had a team of therapists outside that were waiting to see the direction we were going to take. And when they looked at me, they said, Andy, we can't help this kid here. This is outpatient physical therapy. That young kid is too involved. He wouldn't respond to any commands that I would give him. So had like this blank stare, wouldn't respond, wouldn't talk. And I looked and I said, he's not responsive. You can see that he's there, but he's not responding to me. And so I looked, I was so like, to see that mother in such agony and pain, and I was like her last hope. I look at her and I said, you know what, ma'am, here's what I'm going to do. I'm going to do everything in my body and in my power and in my financial power to be able to help your son. And I went outside and I told my team, I said, hey guys, guess what? We're going to take on this case. They looked at me like, Andy, what are you talking about? This is insane. Well, little by little, month by month, and week and day by day, we got this young kid to walk. I think it was within 5 months, to walk out of our facility, out to his car without a walker and without a wheelchair. This was one of the most emotional moments of my life, because we were in a shopping center where our glass was, people could see what's going on, right? Because we were at a retail shopping center. And so you would see the neighbors, they would see this young kid. He was so full of light, so full of energy. And when everybody saw him at the shopping center walking out to his car by himself, it was like an amazing moment for the whole community that was there cheering him on. It was really emotional moment. But at that moment, I realized something else. There's a lot of need for people who are uninsured or non-insured in this industry. And I've been able to help a few more people, kind of like him, that come from hospitals. And I've always said yes to people, because that is such a rewarding moment when you get to see somebody that, they have no other choice. Nobody's going to see them because they have no insurance, or they're really low income. So we've been able to take a few of those cases.
Well, I mean, it's things like that people really latch on to, and they see that you care in your business and you're doing everything possible, and that's maybe one of the main reasons why your business has grown as it has. Tell me about what stage your business is at now.
So our business is strong. We're in a very I think we're at the right place at the right time, because the insurance, like I said, love physical therapists. They pay us very well, and again, it costs less than surgery. So for us, we're a winning situation for insurance companies. That's one thing. The second thing is, we've really helped thousands and thousands and thousands of people in our community, and that the word of mouth within our community has made us very strong. The hospital systems, they love us as well. They send us tons of patients. And because we've been able to do what we say we do, which is we get you, we recover you in the right amount of time, for the right amount of price, kind of, then the word of mouth has really spread throughout Miami. And we started with one facility. Quickly, we were kind of like supply and demand. The referral sources were demanding another location, and then they were just demanding a third and fourth and fifth. Now we have 21 facilities between Dade, Broward, Palm Beach, and we actually have one in Tallahassee. And the demand is there. So people are asking, hey, Andy, when can you build another one in West Palm Beach? Hey, Andy, when can you go to Orlando? And it's we have to grow at a certain pace so we don't lose control. But we are growing very fast, and we are very strong, thankfully.
Well, congratulations for that. That's great, especially that you're getting a lot of that business through referral. That definitely shows that you're doing something right, and the outcome that these patients are experiencing is something worth talking about.
Yeah, I think we're up to 98% of our business comes from word of mouth. 2% comes from the internet and the SEO that we do online. But about 98% comes from word of mouth. So we've never done a big marketing campaign, and thankfully we are full of patients. We're now, the reason we changed the name, like I said, is because now instead of making an appointment to come to physical therapy in a week or 2 weeks like we used to do, now we're trying to emphasize that you can come to physical therapy now, today, not tomorrow, today.
And that does take a little bit of education, that's for sure, to change that misconception that you need to go to your physician first and get that prescription. So the physical therapy now is definitely a good title for the business. So exactly. Where is the business going from here, Andy? Obviously you're in Florida now. Are there ambitions to get outside the state?
So we've actually created a franchise system now where I'm able to teach entrepreneurs or other physical occupational therapists, chiropractors, the business of physical therapy, how to be successful, right? So we created a franchise system. But I'm pretty sure we're going to have about 80 centers in the next 3 years in the state of Florida if we continue to expand at the rate that we're going to expand. Or we're planning to expand. And I do have a little bit of interest in Texas and in New Jersey, just because the laws are very similar to the state of Florida. So my plan or my goal is to have 100 centers within 3 years, in between 80% of those to be in Florida, and then 20% to be in Texas and New Jersey.
That is awesome. And that's with a franchise model. So obviously, any physical therapist out there that wants a proven system that can plug into a franchise like Physical Therapy Now should contact you. What is the best way for people, whether they need help in the Florida area with their pain management or injuries, or whether they want to learn more about the franchise? What's the best way for them to get in touch with you?
Very easy. You go to www.physicaltherapynow.com, and in there you will see a tab for scheduling and making appointments right on the homepage, and it'll take you to the direction you want to go, what location you want to go. Or if you want to learn more about the franchise, we have a nice Q&A system or questionnaire that we have on the homepage as well. You go to franchise and you'll learn a lot about the franchise, and then we can schedule an appointment where you can have more of a one-on-one conversation with my team, and we'll teach you a little bit more about how Physical Therapy Now and you can partner up.
Excellent. Well, we've been talking with Andy Zapata. He's the CEO of Physical Therapy Now. Andy, any last thoughts? You've given us quite a bit of information here, but is there anything that you would like to share with our audience before we go?
No, I mean, if anybody has any pain, suffering from acute or chronic pain, or you've had an accident, an injury, and you just wanted to see if we are the right fit for you, to see if we can help, we would love to have a conversation with you on the phone before you come into the practice to make sure that we can help you. I'm pretty sure we can, but I always like to reach out and give that option to my clients to see if you want to talk to a therapist on the phone without having to come in first. That option is always available.
Well, definitely we need to get that education out there that physical therapy is now, and it should be the first thought when you have pain is to see a physical therapist, and even get on the phone like you just suggested is probably a great first step.
That's right. And like you said, things are changing, and the laws and the legislation is changing, and you do not need a prescription to come see a physical therapist. You can come directly today, now, Physical Therapy Now, and that's why we decided to go with that name.
Well, Andy, thank you very much for being a guest on the Business Authority Radio Show.
Thank you, Neil, and I hope to talk to you soon.
And to our listening audience, if you like what you hear, hit that like button and share, and we'll see you next time on the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show, or to listen to past episodes, visit businessauthorityradio.com.